I was trained in late 80s, early 90s at Guy's Hospital, which is now King's, and I felt at the time that there was a higher level of professionalism. There was an echelon of gravitas at the top of our profession, where there would be a certain number of names or positions that would be held, and there was a kind of awe of these people, both as academicians and as clinicians and as personalities. And I feel that that gravitas seems to have been lost a little bit from the profession, and I'm quite conscious of the fact that a lot of the younger dentists out there are not trained as well, I feel, as we were, both as an ethos and also clinically. I'm aware there have been considerable cuts to the training pathway in dentistry so that there isn't as much clinical experience with younger dentists as they come out. And I also feel that there is a gradual slide of the profession from being a profession into being more of a sales industry to try to sell treatments that are fashionable, and sometimes exceeding the limits of what really should be done. And I'm a little bit concerned that the profession is going in a direction where the patients may not be getting the best advice and the best care over the long term in the short-term interests of trying to fulfill a fashion or a fad that's going around at the moment. So some people may call me a little bit old-fashioned, and I guess I am. I've been around for a long time, 35 years in practice, but I kind of still feel that our primary duty is to the long-term welfare of a patient. So if we are prescribing something, if we are recommending something, it should be the same sort of stuff that we would recommend for members of our own family or our friends or our colleagues and people we love. And if we're not doing that, if we're doing stuff on patients that we wouldn't have done to ourselves or wouldn't do on our colleagues, I think there has to be the question asked, then why are you doing it? And I feel there is a slide within the profession to the point where it may be difficult to retrieve if it carries on the current path.